Are you someone who's been diagnosed with Morton's Neuroma? Tired of getting the cortisone injections, not really loving the idea of surgery, or maybe you've even had the surgery already? If this is something that resonates with you, sit tight because this is certainly going to be a video you'll benefit from. In case you were given a less than helpful explanation as to what a Morton's Neuroma is, let's take a moment to do a quick 101 review. So Morton's Neuroma is going to occur in the inner spaces between the lesser toes. So the most common site for a neuroma to occur is between toes 3 and 4. And what happens is as the nerves in that area get irritated, the nerve sheath is actually going to begin to enlarge in order to protect the nerves. Eventually, the sheath can become so large that it begins to push the toes apart. The nerves commonly involved in the formation of a neuroma are branches of the medial plantar nerve, which is one of the major nerves in the foot. The more commonly known and widely used treatments for Morton's Neuroma are actually injections, orthotics, maybe some rehab exercises, and potentially surgery to remove the involved nerve. If we have a diagnosis of a Morton's Neuroma or had a Morton's Neuroma that was previously removed, in addition to addressing the tissues in the foot, the other area that needs to be looked at is the ankle, particularly ankle dorsiflexion range of motion. When a reduction in ankle dorsiflexion is present, treatment to remove adhesion in the calf tissues is also going to be performed in order to help improve that range of motion. And if you have interest in seeing what adhesion removal in the calf tissues actually looks like, I encourage you to go to our social media platforms and look at some videos that we have covering that topic. Unlike more commonly known treatments for a neuroma, here at Barefoot, we prefer to take a much more hands-on approach, specifically looking to see how much adhesion you have built up around the involved nerves. So just remember, when we have adhesion around a nerve, it's going to prevent that nerve from gliding past the surrounding tissues. As a result, this is going to impact not only the health of the nerve, but also its function. In addition to treating the nerves at the site of the neuroma, we also have the ability to treat the medial plantar nerve further up in the foot, which is something that is not often addressed in other treatments. Now let's take a look at what treatment of a neuroma actually looks like. So to start, we're going to look at the site of the neuroma up by the toes. So let's say we have a neuroma between the third and fourth toes. What we're going to do first is some diagnostic passes to get an idea of how much adhesion we have in the area. So, once we have our adhesion grade, we can begin doing treatment passes and break down the adhesion. As I said previously, in addition to treating the nerves at the site of the neuroma, we're also going to treat the nerve that those smaller nerves branch off of, called the medial plantar nerve, which is further up in the foot here. So to start, we're going to do the same thing we did with the toes. We're going to do some diagnostic passes first, see how much adhesion we have in the area. Okay. Once we have our grade again and we know how much adhesion is there, we can begin doing treatment passes. And again, as we go through each pass, we're looking for the adhesion to begin breaking down. And over the course of treatment, we're looking for the amount of adhesion to reduce over time so the nerve can heal and function better. In doing so, not only have we addressed the adhesion and the nerves at the site of the neuroma, we've also addressed the adhesion further up off the main nerve. Morton's Neuroma is a tough condition to deal with. What makes it so hard is that you have to use your feet for everyday activities, which is going to make it very hard not to load the involved nerve. However, before you consider something more permanent like surgery, I really encourage you to take a more conservative approach to treatment. This way, the involved structures can be properly addressed, as well as the tissues that are also contributing to the problem. If this is a condition that you've been struggling to manage, give us a call or send us a DM, and let's see what going barefoot can do for you. Till then, this is Dr. Jeff saying ciao for now.